Hello guys, so today I want to briefly talk about microneedling treatment for stretch marks and combination modalities to get absolute results. But first, let me explain what stretch mark is for those who aren't aware, even though we know it's a very popular skin condition that affects a lot of Africans, both male and female. So stretch mark is a dermal tear, simply put, when your skin has overstretched to the extent that it cannot bounce back, like a rubber band. So you know how you stretch a rubber band and then it keeps contracting, back to its usual state and all of that. Now, when the skin is overstretched to the extent that it cannot contract and pull itself back, that's how stretch mark forms. So there's a tear or a dermal damage. The tissue there is damaged, and as a result of that, you have the straw lines coming out, right? So now this can happen to anybody, both male and female, and there are causes to this. Obesity can cause it, hormonal changes in the body can cause it, even medication, and the worst or the very common cause that we see in Nigeria right now is as a result of cream reaction, where steroids, mercuries are added to skincare products, and then people use it, and before you know what's happening, they're already having stretch marks on their skin. So we have different types of stretch marks. We have the very commonest one, the strap alba. The strap alba is the one that we see almost on everybody's body. Your buttocks, your breasts, your arm area, and all of that is very difficult to treat. Most times I just tell people to leave it, or better still camouflage it. And then we have the strap rubra, the reddish stretch marks that looks as if you have an injury on your skin. So this particular stretch marks is very easy to treat. Most important is you attacking and addressing it while it's still new. So you don't have to wait for it to now get darker, after some years, and that's when you want to start treating it. Now, there are procedures that you can do that can help with the stretch marks, and microneedling is one of them. It's very common. Almost everybody does microneedling at their practice or their aesthetic clinic, and it's a very common procedure because it helps to induce collagen around the area, and that will further blend out the stretch marks and all. But stretch mark is a very difficult skin condition to treat because it's in the dermal layer, not the epidermis that can easily heal itself. In the dermal layer, you need a little bit of stimulation for the healing to take place. And while treating stretch marks, it's very important that you combine it with other modalities. Like the microneedling that I just mentioned, you combine it with other modalities to get absolute best result. So now what I want to discuss is the combination procedures for microneedling in addressing stretch marks. So the first procedure that you can combine microneedling with in addressing stretch marks is PRP. PRP is platelet-rich plasma, and the platelet contains a lot of growth factor. So with the microneedling, this can be microneedled into the skin. So microneedling will cause micro injuries on the skin and then further push in this growth factor down to the dermal layer of the skin. You can also do microneedling with other stretch mark ampoules. There are ampoules that helps in addressing stretch marks. They are basically formulated. These are vitamins or scientific formulations that addresses stretch marks in particular. So you can also combine that with microneedling. You can combine microneedling with radio frequency. So you can do radio frequency, combine microneedling. The heat that is being transmitted from the needles of the frequency into the dermal layer helps to tighten the skin. Microneedling can also be combined with carboxy therapy. So when you're treating your stretch marks, combination treatment is what you need because it's the best way for you to get absolute result. Most times you see people do microneedling, and after a while you see them the next session they might do microdermabrasion and chemical peel. Now they aren't just wasting your money, they are doing the right thing for you because they know that with this approach you're going to get good results with your stretch mark. Remember, if you don't take home anything that I said this afternoon, take home one thing: stretch mark is very difficult to treat. It's in the dermal layer. If it's gotten to the part of it being strata alba, know that the treatment has to be, it's going to take a while for you to even see any significant difference. And if it's in strata alba state, you cannot completely clear it out.